Good morning, my name is Pooja Chitwa. My topic is wrist stroke. What is wrist stroke? It is a pathological condition in which there is injury to the radial nerve resulting in impairment nerve function causing a radial nerve palsy. Wrist stroke is the characteristic clinical sign of the radial nerve palsy. It is the condition where a person cannot extend their wrist and it hangs flaccidly. Radial nerve pathway. Radial nerve start formed from the posterior cord, supplies the triceps and behind the humerus and the spiral groove. It lies between the brachioradialis and the brachialis at the elbow. Gives the superficial and the deep terminal branch in the forearm and the wrist. Condition is referred often as the Saturday night palsy, crutch palsy and the honeymoon palsy. So, Saturday night palsy. Alcohol is sometimes as a person fall asleep with back of their arm compressed by a chair back and the bar edge. Crutch palsy. Compression of the nerve from the walking with the crutches. Crutches in the exit. Honeymoon palsy. From another individual sleeping on one arm overnight compressing the nerve. Now, what is the pathology of the wrist stroke? Radial nerve supplies a posterior arm and the forearm. It supplies to the muscle like the triceps brachii, extensor carpi radialis, extensor digitorum communis. If damage occurs, result in the wrist stroke. What are the cause of the radial nerve palsy? Trauma, infection, exposure of the toxin. What are the cause? With the continuing with the cause. Penetrating trauma can cause injury anywhere along the nerve. Compressive lesion high in the axilla can occur from improper use of the crutches, like we can say previously. Compressed injury at the humeral spiral groove occur in the patient with the sustained compression of this area over a period of the several hours. Subluxation of the radius can produce a radial nerve injury in the proximal forearm. What are the symptoms? Symptoms are depend on the site and the lesion. Most common reported symptom is the wrist stroke. Elbow. Above the elbow, numbness in the forearm and hand. In the forearm, only the wrist stroke. In the wrist, sensory change in the paresthesia only of the back of the hand. Motor weakness is not present. Symptoms including also a sharp and burning pain, numbness and the tingling, trouble the straightening of the arm, trouble to moving of wrist and the finger, dropping of the wrist and the finger like this one. Weakness in the hand grip. What are the diagnoses? Range of motion of the wrist are the affected. Blood test, CT scan, electromyography, nerve conduction test are the different diagnoses to diagnose the wrist stroke. Treatment depend on the underlying cause. Analgesic and anti-inflammatory medications, steroid injection, splint and the braces, physiotherapy, management, massage, acupuncture we are used for the treatment. What are the management? The majority of the cases are managed conservatively with the physical therapy and a wrist splint. Thus, a physical therapist must involved in the care of the patient. If the cause is neurological, then the patient will need a continuous follow-up with the neurological team. So, thank you.